A California kindergarten teacher is facing outrage after discussing gender identity with her students.
Kindergartners came home very confused about whether or not you can pick your gender, whether or not they really were a boy or a girl.
Since 2017, the number of youth who identify as transgender has nearly doubled.
You can't tell what your gender is by looking at your body. Gender is something you feel on the inside.
When you were little, did you feel like you were trapped in the wrong body?
Yeah.
Lately, the topic of transgenderism has been on the public's consciousness more than ever. And unfortunately, most people really don't know that much about it. Many think that being trans is just like being gay, and that we simply need more acceptance of people who identify as trans, even though this typically means that they will receive harmful, irreversible medical treatments. Due to misguided progressive politics, we now have many young people undergoing medical transition, rates of detransition increasing, and men taking over women's spaces. Let's take a look at what's going on and why this is happening.
When someone is transgender, oftentimes the first question people ask is why? And the answer is we really don't know. In truth, we don't have any test that we can do, such as a blood test or an X-ray.
Up until the 2010s, medical transition was quite rare. Before that, 1 in 10,000 males and 1 in 30,000 females underwent medical transition. Today, 1 in 20 college students identify as transgender, and the medical treatments for children have skyrocketed. Medical transition is any procedure or medication that alters the body so as to be perceived as the opposite sex. And this includes using puberty blockers on children to keep them from developing secondary sex characteristics such as breasts and body hair, and the administration of cross-sex hormones and surgeries. So why the drastic increase in people identifying as trans? Many people say that our society is now just more accepting, and that explains the numbers. But the truth is more complicated and alarming.
Your children will see us. Your children will love us, and your children will join us.
In the 1990s, the T was added to LGB, which made people think that being trans was the same as being gay. Queer theory took hold in academic institutions and elsewhere, and this so-called theory blurred the boundaries of sexual identity and attempted to show that sex and gender were not binary categories. It also dismantled the standard way we think about a healthy family structure, which now leads questioning kids to seek guidance online instead of from their parents.
So I'll give you a little tip about going no contact with your family.
Identity politics also became popular in the 90s, which glorified anyone who's seen as a victim. And a key change arrived into how therapy was carried out as a new concept called gender affirmative care was introduced. This approach affirms the patient's identity no matter what age and no matter whether they are mentally ill. Throughout the 2000s, as the AIDS crisis ebbed, gay rights organizations sought to keep their funding. Since these organizations were achieving their goals, they now needed a new rights frontier. Enter trans rights. So, funding once used for gay rights campaigns started to be used for trans rights, and wealthy trans people started funding WPATH and capturing institutions in a bid to normalize medical transition so their identity would become more accepted. At the very same time, the porn industry also started to capitalize on trans porn, and kids were taught at a young age to question their gender in schools, that sex and gender are spectrums, and that some people are simply born in the wrong body.
This is real. And it's cool.
In the 2010s, most teenagers started carrying around smartphones and using social media, which has made them much more anxious and more easily influenced by trans rights messages. And in the vacuum created by our post-religious age, arguably more and more young people developed an identity crisis and sought solace in the idea of transcending their mundane lives and escaping their problems by believing they could become something that they're not. Today, we have a 5,000% increase among females and a 2,000% increase among males under 18 who have gender dysphoria, which is a feeling of incongruence with the gender or sex they're born with. In the past, gender dysphoria was vanishingly rare and primarily experienced among a small number of young children and some middle-aged males. But this new cohort has what is called ROGD, or rapid onset gender dysphoria. ROGD is used to describe the phenomenon of adolescents who suddenly experience a socially mediated expression of gender dysphoria. Close to half of those who suffer from ROGD have been isolated from their peers, have engaged in self-harm, and have had traumatic life events prior to ROGD. The kids who experience ROGD are often challenged by autism, ADHD, OCD, anxiety, eating disorders, or some other mental health issue. They are typically naive and tend to believe that they can become a different person through medical transition. They think it might solve all their problems and are often encouraged in this thinking by medical professionals, rather than given a proper diagnosis and a broader perspective on their struggles. There are many well-meaning medical professionals, including social workers, therapists, doctors, and surgeons, who advise on or perform medical transitions for young and vulnerable people because they believe that they're helping them. However, many in the medical profession just see an opportunity to capitalize on a new industry with very little thought as to how their guidance or medical interventions may irreparably harm their patients. Some of these doctors pretend to offer solutions to mentally ill patients that they know are unlikely to satisfy them. They claim that if these surgeries are not performed, that the patients will commit suicide.
Gender-affirming care is life-saving. Access to healthcare is a basic human right.
But we now know that people who medically transition are over 19 times more likely to die by suicide compared to the general population. A phalloplasty is just one example of a drastic surgery that offers females something like a fake penis, but the results are far from the real thing and often involve life-threatening complications and infections. Many of the young people who undergo these medical procedures decide to detransition or stop identifying as the opposite sex. It's very difficult to know how common detransitioning is because 76% of the patients don't inform the clinic that they've detransitioned. Detransitioners are often left with unmistakably altered and damaged bodies that cannot heal. Transactivists will tell you that detransition is extremely rare, but one metric is the detrans subreddit, which had less than 1,000 members in 2019 and now has over 50,000 members. Detransitioners often wait years to detransition, likely due to social stigma and the discomfort of realizing they've made a mistake. A key reason why transgender identities are now more popular than ever is due to AGPs, or autogynephiles. They attempt to influence young people on social media, and very wealthy AGPs have started foundations that give money and lobby to change both public perception and the law. An autogynephile is a heterosexual male who's aroused by the thought of himself as a female. This is a paraphilia that channels the AGP's focus onto his body, dress, behavior, and sometimes leads him to medically transition and attempt to look more like a female.
Now I want you to imagine that everyone keeps telling you that you're something else, even though in your heart you know who you are.
Transgender care has become a major billion-dollar industry, thanks in part to people like Jennifer Pritzker, Martine Rothblatt, George Soros, and many others. The industry is booming. In addition to the wealthy trans activists pushing their agenda onto society, activist-led organizations like WPATH, or World Professional Association for Transgender Healthcare, set the standards of care that doctors use and shape the medical associations in their understanding of trans healthcare. WPATH has changed the DSM, collaborated with corporations to create templates for transgender medical benefits, and WPATH also informs the AMA, APA, AAP, the Endocrine Society, and all the main American medical associations. WPATH even informs the WHO, the UN, and the EU to promote transgenderism. The trans medical industry is enormous and only growing. Once a patient begins puberty blockers, they are customers for life. Cross-sex hormones and surgeries add billions of dollars more to the industry. A full cosmetic transition can cost upwards of $100,000 per person. The multi-billion-dollar trans industry relies on activists and even some well-meaning advocates who just don't understand the harm that comes with medical transition. So to recap, the increase in trans identification can be explained by a number of factors. It starts at a young age when kids learn to question their gender in schools, which is then reinforced by social media, and parents are guilted into affirming their children's new identities so they don't lose custody or worse.
The state of California claimed I was abusive for not affirming her trans identity. I lost my daughter over a name and a pronouns.
And then gender affirmative therapists feed into the child's delusions, and soon enough, many of these young people are on to puberty blockers, cross-sex hormones, and even surgeries that they cannot reverse. The desire for progressive thinking and kindness leads much of the public to support the idea that people can be born in the wrong body, and that maybe their understanding of basic biology has been false all along.
Turns out that sex isn't that straightforward. In fact, biologists today are saying sex is a spectrum.
With all the slogans that the activists constantly push, it's easy to understand why so many people get swept up with the trans movement and believe it to be just another movement for human rights, when it actually doesn't resemble that at all. The world has become flipped upside down, and we have men entering into women's only spaces, children becoming lifelong medical patients, and many people choosing to detransition when they realize that they've been sold a lie. We need a broader perspective, and one that allows exploration while simultaneously promoting acceptance of the bodies that we have and an understanding that no one can change their sex. The international organization Genspect promotes a healthy approach to sex and gender by raising awareness of these issues. We support families impacted by ROGD, provide support to detransitioners, and raise awareness about ROGD, detransition, and AGP. We also highlight the impact of the trans medical industry. Most of all, we advocate for a non-medicalized approach to gender dysphoria. To learn more, go to genspect.org. Thanks for watching.